Hello. Please hit like button and subscribe my channel. Also press bell icon for future video notifications. Thanks.
Pathogens such as SARS-CoV-2 and pneumococcus can cause severe pneumonia. If the airways then fill with fluid, the patient risks developing acute respiratory distress syndrome. Researchers at Charité, Universitätsmedizin Berlin have now discovered the molecular mechanisms that trigger fluid accumulation in the lungs. This also led them to discover a potential new therapy. A cystic fibrosis drug proved effective in their laboratory experiments, raising hope that this could be used to treat pneumonia regardless of the pathogen that caused it. The study has been published in the journal Science Translational Medicine. Pneumonia is the most common cause of fluid buildup in the lungs. This condition, known as pulmonary edema, results in parts of the airspaces filling with fluid instead of air, which prevents them from doing their job of exchanging gases. Patients struggle to breathe and their body can't get enough oxygen. The diagnosis is acute respiratory distress syndrome, or ARDS. Despite cutting-edge medical procedures, roughly 40% of patients with ARDS die in intensive care. The problem is that antibiotics, antivirals, and immune-modulating therapies rarely work well enough, says study leader Professor Dr. Wolfgang Kuebler, director of the Institute of Physiology at Charité. That's why we took a very different approach in our study. Instead of focusing on the pathogen, we focused on strengthening the barrier function of the blood vessels in the lungs. This makes sense, as they are the source of the fluid in pulmonary edema. The lung vessels become permeable, allowing fluid from the blood to flow into the surrounding tissue, and thereby flood the airspaces. But what actually causes this? What are the underlying molecular mechanisms? A Charité research team led by Professor Kuebler set out to answer these questions. They performed experiments using cells, lung tissue, and isolated lungs. The study centered on the CFTR chloride channel, which scientists know is mainly found in the mucosal cells of our airways. There, it plays a major role in keeping our mucus thin so it can drain away easily. The researchers have now shown for the first time that cells in the blood vessels of the lungs also have CFTR and that its presence is drastically reduced in pneumonia. To find out what role CFTR plays in the pulmonary vessels and what is happening at the molecular level when the chloride channel is lost, the researchers blocked the channel with an inhibitor and dictated the number of chloride ions in the cells. They then used a special imaging technique known as immunofluorescence imaging. We saw that inhibiting CFTR triggered a molecular cascade that ultimately causes the lungs' blood vessels to begin leaking, says Dr. Lasti Fernanda, who also works at the Institute of Physiology and is the study's LA. Thanks for watching. Please subscribe my channel for more videos.